Clonidine. A 62-year-old man with hypertension stops clonidine abruptly and arrives in the emergency department 2 days later with BP of 240 over 140 millimeters of mercury, heart rate of 130 beats per minute, severe headache, anxiety, sweating, and tremors. How can stopping a blood pressure medicine suddenly make the blood pressure rise even higher than before? Why must clonidine never be discontinued abruptly? The answer lies in the unique central mechanism of clonidine and the phenomenon of rebound hypertension. Mechanism of action. Unlike most antihypertensive drugs that act directly on the heart or blood vessels, clonidine produces its primary effect through central action in the brainstem. It acts on the vasomotor center in the medulla, where it stimulates α₂ receptors. Activation of these receptors inhibits sympathetic outflow from the central nervous system. As a result, there is decreased norepinephrine release, leading to reduced peripheral sympathetic activity. This causes a decrease in heart rate and cardiac output, while also producing decreased peripheral vascular resistance due to reduced vasoconstrictor tone. The combined effect of these actions is a fall in blood pressure. Adverse effects. The most common side effect is sedation and drowsiness, especially during the initial days of therapy, because clonidine acts within the central nervous system. Another important adverse effect is bradycardia, which occurs due to reduced sympathetic stimulation of the heart. Patients may also complain of dry mouth, a frequent and sometimes troublesome side effect caused by decreased salivary secretion. Constipation is another common complaint resulting from reduced gastrointestinal motility. In some patients, erectile dysfunction may occur because suppression of sympathetic outflow can interfere with normal sexual function. Clinical uses. Its primary indication is hypertension, particularly resistant hypertension, where blood pressure remains uncontrolled despite multiple antihypertensive drugs. It is also useful in hypertensive urgency, where oral clonidine can gradually lower blood pressure without the need for intravenous therapy. Another important indication is opioid withdrawal, where clonidine reduces autonomic symptoms during detoxification by suppressing sympathetic overactivity. Clonidine is also used in ADHD, where it helps manage impulsivity and hyperactivity in both children and adults, particularly when stimulants are ineffective or not well tolerated. Finally, clonidine has a role in Tourette syndrome, where it reduces the frequency and severity of tics. Rebound hypertension. Clonidine must never be stopped abruptly. Instead, it should always be tapered slowly. Let's understand why. When clonidine is suddenly discontinued, there is an abrupt clonidine stop, resulting in loss of α₂ inhibition in the brainstem. Without clonidine's inhibitory effect, sympathetic activity rapidly returns, producing a catecholamine surge. This massive release of catecholamines causes severe hypertension and tachycardia, often referred to as rebound hypertension. Without clonidine's brake on the sympathetic system, catecholamines flood the circulation, driving BP to dangerous levels. Therefore, always remember this golden rule. Never stop clonidine abruptly. Always taper it gradually to prevent life-threatening rebound hypertension. Key takeaways. First, clonidine is a central α₂ agonist that acts on the brainstem vasomotor center to reduce sympathetic outflow, thereby lowering blood pressure. Second, it has broad clinical utility. In addition to treating hypertension, it is also used in opioid withdrawal, ADHD, and Tourette syndrome because of its central sympatholytic effects. Finally, remember the most important safety point. Never stop clonidine abruptly. Sudden withdrawal can trigger a rebound catecholamine surge, leading to rebound hypertension and even a hypertensive emergency. Therefore, clonidine should always be tapered slowly.